billing expert for acupuncture and the American Acupuncture Council Network, as well as the American Acupuncture Council Malpractice Insurance, with another time to get with you to update you on what's going on, what's changing, to make sure your practice is thriving. Remember, the American Acupuncture Council is always your partner. If you have a question and need an answer, trust me, we're there for you. So what are we going to talk about today? Medicare. So let's go to the slides. So I want to talk about Medicare because there's so many things that are confusing or misunderstood or misrepresented that I think are going about. And I'm getting so many calls and requests for this, whether it's people on my network or coming to seminars. What is going on with Medicare? What does it really cover? And what is the differences between Medicare Part B and C? Who pays me? So I want to make sure there's a clear understanding. Regular Medicare Part B is what you see on the left side here. That's standard Medicare card. But you're going to note a lot of people have something else called Medicare Advantage. And so we want to kind of talk a little bit about that to make sure there's a really clear understanding of what's going on, because of course you are being inundated with people requesting information or saying, I heard it's covered. Take a look at some of these ads. The upper left is from AARP, where they put out, hey, Medicare will cover acupuncture for back pain. Now, a regular Medicare patient sees these types of things and thinks, well, I want to get the care, because notice even Blue Cross Blue Shield has an ad for it. In addition, here's another one indicating a zero acupuncture for 24 visits. And this is a commercial where they literally show acupuncture on the commercial. Realize acupuncture has become a commodity for these plans because it's their way of enticing people to get their plan. Ooh, join ours because there's a benefit. Now, the confusion, of course, is what are the differences between this Part A and Part B? And really, what is Medicare? Well, who are the Medicare patients? Well, Medicare patients are going to be people 65 and older. Obviously, at least as long as you've paid into Medicare, I think for 10 years, you will automatically get Medicare benefits when 65. But remember, Medicare is not just for people over 65. There could be some people who are younger that have a permanent disability and as a consequence are entitled to Medicare. So don't be surprised when a Medicare patient is younger. But it also could be people with end-stage renal disease, probably not ones that we would see, but certainly the others. Now, what's going on with Medicare is understanding the types of Medicare. Now, we have standard Medicare Part A, which is the one everyone gets. Its hospitalization when you go to the hospital. But the one we're speaking of is very typical as well, and it's Medicare Part B. I'll call that traditional Medicare. So this is the original Medicare benefit that covers going to the hospital, going to a doctor's office, and having a drug benefit. Now, the good news is these people can use anyone within the system, doesn't matter the state, and Medicare pays its portion, and the patient pays 20% of it. So not bad, a good, nice coverage for people who are over 65. For those that don't remember, prior to the implementation of Medicare, many people who are older would literally go bankrupt with any illness. So this has been something that's been quite the good safety net. Bottom line, though, is what's going on for acupuncture. That's what we're concerned about. So you notice I have it in red here, and it says acupuncture is covered, but it says for chronic low back pain only under direct supervision of a medical provider. So all of a sudden, well, yeah, it's covered, but it's only covered when done under medical supervision. So that makes it somewhat limited. The low back pain, of course, is limitations for it as well, but nonetheless, the supervision makes it hard. And part of that reason is acupuncturists have not yet become Medicare providers. We need to get a bill, which we already have one going, that's going to make acupuncture providers under the Social Security Act to be part of Medicare. So until we get that, we're going to be stuck with this type of issue of needing the supervision or referral, if you will, from a medical provider. That bill is being moved, and hopefully we'll see something in the next couple of years. But this is kind of the cart before the horse. If you think of it, Medicare was really going to first do a study of how good acupuncture could be to see if it was working or not. The evidence was so overwhelming, they decided to cover it. The problem was the cart before the horse is, well, they're covering it, but because acupuncturists can't join Medicare, it still had to have some tangential way of getting in, which means under the medical provider, meaning for traditional Medicare Part B, it still has to be billed by a provider within Medicare, and that's limited to basically medical providers. So that one's a little more complicated or a little more difficult, but nonetheless still a positive. Let's talk about, though, also what a lot of you are experiencing and misunderstanding is there's a second type of Medicare that's often referred to as a Medicare Advantage plan, or also known as a Medicare Part C. And I know all those letters can be confusing, but I like to think of it as a Medicare Advantage plan. What a Medicare Advantage plan is a way for a Medicare patient to literally trade their Medicare benefits to this plan. And then this plan takes over for the benefits, and it's under companies like United Healthcare. Aetna, Cigna, all these ones offer them, and they have to offer all the same benefits as regular Medicare. Sometimes it's actually even cheaper, which to me is interesting when you think of it. How is it that we can manage Medicare patients for like 500, 600 a month in premium, yet when we buy premiums for someone that's younger, it's thousands of dollars? Well, that's because it's insurance companies making a profit. Bottom line, though, is that these plans have to cover exactly as Medicare does. So, in other words, they have to cover the low back pain just like Medicare too. However, many of these plans, and you'll see this in the second to last bullet, offer extra benefits like acupuncture. And these can be billed directly by an acupuncturist to the plan without being part of quote unquote Medicare. Now, some of these plans may require you enroll, and I frankly will have no problem with enrolling because it only gets you into the one and gives you access. These can be pretty darn good, but let's understand the difference. Traditional Medicare Part B regular, again, acupuncture is a benefit now, but chronic low back pain only and up to 20 visits a year. So not bad. What it says, though, is that there's 12 visits within 90 days, and assuming the patient improves, another 8. The difficulty for us is that an acupuncturist can perform it, but it must be supervised by a medical provider. And this could be a MD, a DO, a PA, a NP, or a CNS. And so these are all medical providers that are enrolled in Medicare. So in other words, you're working kind of for this person, if you will. It's not a referral, but something you're working with because it has to be billed by them. So to take a look at it, under this national coverage determination, you'll see here it says the most recent is that it will cover for chronic low back pain. And that is defined as back pain that's more than 12 weeks. Now, that doesn't mean like, oh, I've had it exactly 12 weeks, but think of how many Medicare patients talk about, oh my God, I've had back pain on and off for the last 10 years. Well, by definition, that's certainly going to be chronic. It certainly can't be associated with other inflammatory diseases like infections or metastatic cancer, but traditional, as most people get back pain, realize 85 million people a day have it. That kind of makes sense. It will be covered. Now, here's something interesting. Obviously, you're all aware the back pain code's updated. And part of the complications in dealing with this, when they updated, Medicare published what codes they were going to allow. Even though M5450 is one of the codes new for back pain, under the Medicare guides, what they indicated is that it's only going to be M5451 for vertebrogenic or other specified M5459. So make sure if you're billing Medicare, part of the reason if you're getting denials is you have to update to one of these two codes. And bear in mind, there are some payers that have been delaying until April 1st for some reason, but nonetheless, those are the codes. It's back pain. Notice the code doesn't say chronic. It's just the idea, and that's why M5459 is the more likely. Now, it pays up to 12, but notice it says an additional 8 sessions will be covered for patients demonstrating improvement. I think that's fairly straightforward. Most patients, in fact, getting acupuncture with back pain almost always improve, obviously. And so long as that's there, they'll allow additional 8, meaning up to 20. Now, the complication here is this is not a yearly benefit in the way you might think, meaning it starts over in January. It's a rolling year. So by example, it says if the first service is performed on March 21st, the next service beginning the new year can't be until March 1st of the following year. So they do it as a rolling month. So it's literally 20 visits within any 12-month period, not January to January, but it could be from March to March and so forth. Now, the complications here is that physicians can furnish it, of course, medical doctor, certainly could physician assistants, but they also have to have some additional licensure for acupuncture. Bottom line is you'll notice here it says auxiliary personnel can do it so long as you have a master's or a doctoral degree for acupuncture, which is going to be all of you, and therefore you can provide it. Now, here's the problem. You're providing it, but it says here auxiliary personnel furnishing acupuncture must also be under the appropriate level of supervision. Now, a lot of people have misinterpreted appropriate level as thinking, oh, it's just based on a referral and they come in the office. Unfortunately, not that simple. Under this rule, that's under these two regulations of here, 410, 26, and 27, you have to be present in the same office. So it means you've got to be in the office with this medical provider when the service is delivered. They bill for it, but you provide it. This can't be a simple referral, but in the office. This means either you're in their office working, or maybe they come to your office. Realize that a lot of nurse practitioners, CNS, and others are traveling. Maybe they come to your office 1 or 2 days a week. This might be helpful, but this is certainly a benefit for someone working in a larger medical clinic. In fact, this might be an opportunity for someone that goes into a medical practice that does geriatric medicine to deal with low back pain and pain management. So certainly something to think of. But bottom line is, you're going to be working for this medical provider. Now, keep in mind, working for them could be under two ways. It could be as an independent contractor. It also could be as an employee. So either way, it is certainly possible. But again, you can see the limitations here. It has to be done directly under supervision. Now, you may wonder, well, what does Medicare pay? So what I've done is I've just put up a few areas of Medicare payments, and you'll all notice this increased about 10% this year. So a nice little jump for us. And of course, that also helps for the VA as well. But notice in all areas, whether I'm using California, Illinois, Florida, Texas, you'll notice the first set is generally around $40 or higher, maybe up to 45. The additional sets in the 30 range. So I'm just going to round to say 40 for first set, 30 for additional sets, which means approximately 100 plus per visit, because generally you're going to do 3 sets, and I'm not saying always, but generally that's what Medicare allows. That means $100 a visit. That certainly could be pretty good. We'll talk more about that money part of it towards the end, but I think this is something viable. If you're getting 100 per visit, this certainly makes a lot of sense. Now, it'll make the most sense when we can directly, because now if you're working with someone, obviously that $100 per visit has to be split between 2. So therefore, it may not be quite that you're getting that full amount. But again, this is not bad. So again, about 40 first set, 30 for additional sets. Now you notice if you're doing electroacupuncture, it's more like 50 and 40. So now we're looking at probably about 130 if you're doing electroacupuncture. By the way, these fees also will apply to VA, but also to Medicare Advantage, which I'll demonstrate in just a second. But here's what you've probably all been noticing. The Medicare Advantage is an area that I certainly would say you should be looking into. Medicare may have some limits because of the way we can access the patient. Medicare Advantages aren't that complicated. Here's one I took literally off of my television where they are using acupuncture to advertise this plan. And I've seen this over and over. Notice here it says zero copay. In other words, a patient comes in, they pay nothing. Now, with these type of plans, you're generally going to have to be in network and or be a deemed provider, which I'll explain in a moment. But bottom line is these are going to pay approximately the same, and in many instances, more, which is not bad. So when a patient has a Medicare Advantage plan, this is what you'll see. They won't have that traditional Medicare card, but one like this, and you'll notice it literally will say Medicare Advantage right on the card, or Medicare Part C. So that's how you'll know. Be careful though, the person will still have their old Medicare card. So always ask them, let me have all of your Medicare and all of your insurance cards so you can verify, because once they have this plan, they no longer actually have traditional Medicare. They have this plan, they've traded for it. And to give you the numbers, there's about 63 million people with Medicare currently. That's a lot. And about half of them now have Medicare Advantage plans, simply because the benefits with them are often a little bit better, less out of pocket. And yet, what's interesting, how is it can Medicare Advantage plans offer so much, yet it's from a plan that Medicare is paying them $600 a month? And again, I go back to, it shows how much insurance companies profit off of others if they could take the sickest people. So here's an actual card for a Medicare Advantage plan. And this is one that was sent to me. A member of the network was saying, hey, Sam, what does it mean in this Medicare Advantage it plays the Medicare limiting charges? And often that's misunderstood because acupuncturists aren't part of Medicare, so you've never heard the term limiting charge. Medicare has fees that are called par, non-par, and limiting. The limiting charge is literally 15% higher than the regular rate. So you remember those fees I just showed you? Add 15% to that. So let's talk now, probably with these closer to $50 for first set. So I want to make sure when you're billing these Medicare Advantage plans, don't bill what you think they're going to cover. Bill your normal fee. Bill your 60 or 70. If they allow 50, they'll pay it. But if you bill thinking they're only going to pay you 42 and you bill 42, well, sure, they're going to pay you 42. But what if they would have been paying you 50? So always bill your regular rate. Just know that you cannot collect the difference. And this is what brings up this term deemed provider. Many times when you get into these plans, you may have to join, but often you don't. All you have to do is accept the patient. But when you do accept the patient, it's like you become in network on a claim by claim basis. In other words, we call it deemed, D-E-E-M, deemed provider. And what this refers to is this. When you take the patient, then you have to accept what the plan allows for your billing. So in other words, if there's a zero copay, the patient has a zero copay, you accept the plan, or if there's a small copay. Now, these benefits actually are pretty darn good, as you can tell with the limiting charge. Add 15% to what I just said, and you can go, wow, wait a minute. Now, Sam, are you meaning $115 just for acupuncture? Yeah, that's exactly what I mean. Now, these Advantage plans are pretty good. An Advantage plan has to do exactly the same as regular Medicare. So it has to cover just like it does here, what is covered, the chronic back pain. But most of these plans, you'll notice here, it says acupuncture routine. You can find a network care provider, searching for the acupuncture benefits online directory. So what are they looking for? This routine acupuncture. What is routine acupuncture? Routine acupuncture means they cover for pain management. No need for a referral or anything. Notice regular Medicare says they may require a referral or working directly. So I had someone last week contact me and say, hey, Sam, I heard they're going to implement a referral. No. For regular Medicare, because you have to be under supervision. But for these plans, you don't require referrals for routine acupuncture, which means basically pain management, the same you'll bill any United Healthcare plan. To illustrate that, take a look at how they cover it. This is the Medicare Advantage plan for acupuncture. Notice it actually covers dry needling if you choose to do that. Now, I'm going to suspect do acupuncture because that's what you are. It pays more. In addition, you can't combine dry needling with acupuncture anyway, but notice what they cover. Here it's noting routine acupuncture codes, not a complete list. So what I want to highlight, Medicare Advantage plans cover acupuncture, but also cover exams and therapies, because notice it's not a complete list. It lists the E&M codes, acupuncture codes, and then notice therapies, electric stim, infrared, ultrasound, exercise. It could include massage and manual therapy. Always think of what is within your scope, and they will cover it. I have some offices doing some very aggressive care with this. And while I think it's a lot for one visit, I have one office that bills well close to $400 per visit, and he literally gets paid almost all of it under this type of plan. Now, these are patients in a lot of pain and a lot of things going on, but again, pretty good. So a Medicare Advantage plan is something I would probably say I'd want to be part of, because look at the access that they have. The key is, do people know that you're willing to take these plans? Are they aware of it? Have you joined any of them? Because to me, there's no downside. If you join a Medicare Advantage plan, is there any cost? No. If you join a Medicare Advantage plan, does that mean you have to join the regular plans with them? Generally not. You can join just for Medicare Advantage, which means the only downside is you join and you don't get a patient. But assuming you get one or two, more people are looking for it. Think of how many people have pain over age 65. I mean, that's almost a given for many. Let's learn to manage that so that they can start to do it without medication. So I want to make sure you always are up to date. The American Acupuncture Council Network is always updating information. If you're not familiar with our website, please go to our website. It's AAC Info Network, not the insurance, but Info Network. And you'll notice here we put out newsletters. One of the things we just put out, Aetna is adding acupuncture to all of their commercial plans now. So that's a really good benefit, but how would you be aware of it without going to our news section? We want to make sure you're always up to date. So anytime something's changing, we're the resource, just go to our news section. There's no cost for it. Just go to the news section, click on it, take a look once a week, sign up for our email alert, and you'll get that as well. We also post it out on our social media. In addition, though, notice here about how to deal with financial agreements. Remember, we did the No Surprise not long ago. So we're going to be a resource for you. Allow me to be part of your practice. We have a hotline service where you can call me, email me, fax me on any type of information you need questions with. We're here to help you get paid. We have a vested interest. We want your success. I do, because I really want to, before I retire, make sure acupuncture is fully integrated into Medicare. So take a look at our hotline, and we're always going to be a resource with you. The American Acupuncture Council Network, go to our site, give us a call. We're here to help. I'm going to say thank you, everyone, very much. We're going to have a special Friday show, and the guest host will be Shelley Goldstein. And I'm going to say to all of you, be well, take care of yourself, and remember, you're important, but it's more important to be good. Thanks, everyone.